evening, ladies and gentlemen. My name is Dr. Mansur Dada. I'm the incident manager of the Bauchi State Immunization Emergency Operations Center in Nigeria. Nigeria is a country in western part of Africa with a population of more than 170 million, and it has 36 states, and one of these states is Bauchi State. So Bauchi State is one of the states in the northern parts of Nigeria, and Nigeria happened to be in the list of the polio endemic states and endemic countries until recently, about 2 months ago, when the country was removed from the list of the endemic countries. Prior to the removal of Nigeria, the countries that are polio endemic are Pakistan, Nigeria, and Afghanistan. But as a result of the progress that was made in the last 2 to 3 years in Nigeria, Nigeria has spent almost 15 months now without a case of polio. So as a result of that, Nigeria was removed from the list of the endemic countries. The northern states, the state in the northern part of Nigeria, which are about 12 to 14 in number, are the areas where that actually retarded the progress in the polio eradication program in Nigeria. So these problems are actually as a result of many challenges, ranging from number one, non-compliance as a result of different reasons, but the major reason why people don't comply, refuse to actually accept the polio immunization, are mostly religious reasons. Then there are other reasons like fear of whether the vaccine has maybe a long-term effect on their health, and then others that think it's not a priority for them, and then other issues like lack of accountability and lack of transparency and accountability in the whole system, and a lot of problems. So in 2012, after about 17 years or 15 years of the polio eradication program in Nigeria, in 2012, when the country realized that there are some big stumbling blocks that are actually stopping the country from making progress, and after that declaration during the World Health Assembly that polio eradication is now a public health emergency, there are a lot of measures that were taken from the national to the state level in order to actually address those challenges that cause retardation in the polio eradication program. The first issue was the issue of the non-compliance. There was a complete change of strategy where the polio emergency operation centers were established at the very high-risk states in the country, where these centers were established in about 6 states, and Bauchi State happened to be one of these states, and then a national polio emergency operation center was established in the federal capital of Nigeria, which is actually Abuja. This actually has helped in the total coordination and implementation of the polio eradication program in the last 2 years in the country. Then, apart from the establishment of the polio emergency operation centers, another very important action that was taken was the a total engagement of the traditional rulers and religious leaders from the highest level, national to state level, and to the local government, and to the ward, and even to the settlement level, where these community and religious leaders are carried along. Whenever there is any problem of non-compliance, this set of traditional leaders and religious leaders were trained in such a way that they will sit down with the non-compliant households and the heads of the family and discuss what was actually the reason behind their rejection of polio. And when they discuss with them, they see reason in it, they normally comply. So that partnership between the government, international partners and the traditional institutions as well as has actually helped a lot in resolving a lot of the refusal of the polio vaccine. There are other innovations that were actually that came up in order to address these challenges, which this has actually helped a lot in this has actually helped a lot in making a lot of progress in the polio program in Nigeria. Then apart from that, there are a lot of international partners that came in to Nigeria and partner with those high risk states, those states that have a lot of issues. That is where a memorandum of understanding is signed between the state governments and these funding partners in order to strengthen routine immunization. Routine immunization being one of the pillars in polio eradication. An example of that is the signing of the MOU between Bill and Melinda Gates Foundation, Dangote Foundation, and Kano State Government, which was followed by the second one, which is presently in our state, that is Bauchi State, between Bill and Melinda Gates Foundation, Dangote Foundation, United States Agency, USAID, and then the Bauchi State Government. That memorandum of understanding has actually helped a lot in funding the routine immunization program, which is also another backbone in the polio eradication program. So in summary, these are some of the issues that the federal government and of Nigeria, the state government, traditional or religious institutions were able to address in the last 2 years, which has actually translated into the progress where now Nigeria has recorded good 15 months without a case of wild polio virus, while Bauchi State, where we are working, has actually spent is in its 25th month without a case of polio. So we are hoping in the next 2 years Nigeria will eradicate polio.